There's been mixed reactions to the Prime Minister and the government's four-step plan to get out of the vaccine, to get people fully vaccinated. Is it enough, particularly the level of detail that we've been given on how this is going to be achieved?
Well, first of all, we need a plan. So I think it's a step forward that they're actually talking about a plan. But really what they presented is more of a plan to make a plan. It's not concrete. It really doesn't have sufficient details, there. But, I think with COVID, you need to be fairly flexible. So I don't necessarily have a problem that they don't have every step of the journey mapped out. But we do need more specifics, particularly for the initial two phases of the plan to open up.
So with respect to how this latest lockdown has been happening, particularly in New South Wales, I know in our areas it's very densely populated, and even out and about on the weekend you see very few people wearing masks, even with parks and public areas being so busy. Everyone's just getting about life as though it's completely normal. A lot of retail stores are still open as well. Is this the way to get out of these cluster outbreaks? I know that you're saying that a lot of these measures really need to be put in place until such point that we reach some level of herd immunity.
Well, I think that masks should be here to stay in some circumstances. It's not so much outdoors, but more when people are going into malls and in indoor spaces that may be poorly ventilated, and there may be a lot of close contact, not, extremely close contact, but, going by individuals, being potentially exposed to the so-called fleeting contact, where we've actually seen the Delta variant be able to transmit even without a lot of actual time spent between individuals, just passers-by. So I think that using masks in that circumstance makes sense. Now, masks outside, that's different because, we know that the chance of transmission is much lower outside, and that's primarily because the virus disperses. So just like if you're smoking outside, the smoke disperses. It's the same thing with COVID-19. When people speaking, the virus disperses and people around them are at less risk. Now, that doesn't mean if you're seated outdoors in a wedding or something like that there isn't some risk of transmission. We saw that with the Rose Garden super spreader event in the United States. So there is potential to spread outdoors. So, you saw some of the shots from yesterday or the day before in Sydney. It's hard to know how close those people are because, you can play some games with photography in terms of perspective. But, if you're close to people outdoors, you should be wearing a mask. In other cases, not necessarily.
Nancy, just how realistic are the vaccination goals set out by the Morrison administration, given that specific vaccination rates have not been identified?
Yeah, well, I mean, they haven't set vaccination goals, and we need to. So we need to set some goals so that people can galvanize around those numbers and be motivated by those numbers. We need an entire reset of the vaccination program in terms of how we communicate to people, communicate the benefits, communicate the risks, and inspire people to get out and get vaccinated. I think they're holding off because they just don't have adequate supply of Pfizer yet. They're holding off until they get the supply so that they, have kind of unbroken momentum leading into the spring here. But it's allowed vaccine hesitancy to just increase here. Not so much because I don't think it's because people don't plan to get vaccinated at some point. They just are really confused by all the mixed messages and just really don't know what to do because they haven't been guided in the right direction. But we do need numbers, and given that there's no current...
Just on the confusion without the clear timeline and clear rates goals, there's also confusion for businesses as well as households with the delayed reopening of borders also looking to be a drag given the shortages of talent the companies will be able to tap. So what could there be in the plan that is needed to allow for quicker reopening of Australia's borders?
Well, I mean, it's naive to believe that we can truly reopen until we have a high proportion vaccinated, because that will just be an absolute unmitigated disaster for Australia in terms of death and illness from COVID-19. However, I think that we need to start thinking about stratified quarantine and stratified risk for international travelers. What do I mean by that? I mean, right now we're treating everyone as if they have the same risk, but clearly they don't. So we need to think about where people are coming from in terms of, how out of control COVID-19 is in that jurisdiction. And we also need to think about whether the individual traveler has been vaccinated or not. Because if someone's coming from, say, New Zealand and has been vaccinated, that's a very, very low risk scenario. We already have a bubble, so those people aren't being treated the same. But in many countries with a very low rate of COVID, even vaccinated people are being put into the same 2-week quarantine and are subject to the same decrease in travel we've just instituted. So we've halved the number of travelers that will be returning. But remember, some of those are going to be extremely low risk. So it doesn't make sense that we've halved it and we've restricted people who had, essentially almost zero risk of community spread if they came back to Australia. So I think moving forward, we need to get a lot smarter about how we quarantine people and how we let people in.
Nancy, when you take a look at the epidemiology of this disease and, of course, the various variants that we've seen so far, what is most likely to you? Does it turn into a seasonal flu, as the Prime Minister has suggested? Do we then just, manage it as opposed to attempting to eliminate it? Is it more like a measles situation?
Well, we do need to open up, and we will need to manage COVID in our midst. So we're not going to be able to maintain this COVID zero status that we have. But this is not the flu. Anyone still saying that this is the flu, this is clearly not the flu. When we look at the flu outcomes for the past 2 years in Australia, the rate of deaths and illness from the flu are dramatically down. So the things that we're doing to control COVID have eliminated almost the flu or sickness from the flu, but they still haven't eliminated COVID. So actually the flu is easier to deal with than COVID is. So I think the analogies to the flu are just misguided and we should just stop them. I'm really actually surprised that people continue to use these analogies because they're so unhelpful. So what I think we need to do is we need to accept the fact that, we have to open up. We need to be extremely highly vaccinated. But then I think that just relying on vaccination will not really get us as quickly to be able to be fully open and not protect people the way they could be protected if instead of bringing COVID in and ignoring that we are living with COVID, we actually accept that we're living with COVID, and we take institute measures such as wearing masks when we're in malls and things like that, improving the ventilation in our homes and in our offices, and finally not going to work when we're sick. I think that's so important, not going to work when we're sick, working from home when we're ill. I think we need to do those things if we really want to make sure that COVID doesn't kind of spread like wildfire amongst the unvaccinated, and we protect people from illness and from death.
Children under 18s have been seen as the last missing, puzzle piece when it comes to the vaccination effort, and we've seen some troubling evidence so far that the Delta variant may affect children more than previous variants. When do you think kids in Australia should be vaccinated?
Well, we don't know that Delta is actually worse in children or more infectious in children proportionally. We just think right now it seems that Delta is just more infective, and so then therefore more children are becoming infected. It's not targeting kids. But what we're seeing in the UK is that if kids are not vaccinated, kids are going to start getting COVID, and that's going to be the main source of COVID spread in the community. And the same thing's going to happen in Australia if children aren't vaccinated. ATAGI, that's our vaccination expert group that gives guidance on vaccines, is considering Pfizer for the tweens and teenagers, 12 to 17, and guidance is expected soon. I don't expect it to be different than what many other countries have decided, that the risks and benefits of Pfizer are such that it's recommended in 12 to 17-year-olds. That's pretty critical because, even an 80% vaccination rate amongst adults won't really be enough to get us to not even herd immunity, but controllable COVID, unless we include 12 to 17-year-olds in that group.